lots to talk about. Let's get straight down to it. Social
Sure.
care. Tonight, this morning, the Cabinet are going to be told the details of a social care plan. Then they're going to vote for it and agree to it, despite, of course, not having any more detail than you or I have right now. It's going to be announced in the afternoon, and then there's going to be a press conference this evening. From what you understand of what the government's plan is right now in terms of raising national insurance contributions, but for the first time having over 65s pay, we think, just this extra bit of the levy as the health and social care levy. Do you support it?
Well, the problem is, Julia, that the thing we've read a lot in the papers is all about the funding of social care, which is obviously very important. What I actually want to hear, and I hope the Prime Minister will set this out today when he sets out his statement in the House of Commons, I want to hear about the actual reform of social care. So I want to hear about what we're going to do to improve the quality of care that people get, how we're going to, for example, deal with the workforce shortage, which already exists, but which we're actually going to make worse by having compulsory vaccination for care workers, which the government itself accepts is going to drive 40,000 care workers out of the system. And I chair the all-party group on learning disability, and many of your viewers may not realise, but actually over half of the public money that goes into the care system in England isn't actually for older people at all. It's for people of working age, for people with a disability, for example, a learning disability, who we want and they want to be as independent and contributing to society as possible. But the system doesn't work very well. So I want the Prime Minister to set that out. And that's really the test. It's not just about the money. It's about what you get for the money. And I think that's how you need to judge the proposals. Money going in, but what we get out of it. And I haven't heard any detail about that at all.
One thing we've learned about government so far is very much, yes, but spending a lot more money on something doesn't necessarily mean you get any better services for it. Very crucially, though, the plan to raise national insurance is a breach of a very clear, crystal clear manifesto pledge. We will not raise income tax, national insurance contributions or VAT. A lot of Conservatives also say this is about a bigger state. This could be a Labour proposal, that it's a tax on jobs, it's a tax on people going out to work, on earned income. It's not a tax on, for instance, money people have earned, the value of their homes or the value of their investments. Crucially, it's regressive compared to income tax. It's paid by people on the lowest incomes long before they hit the threshold of paying any income tax at all. And it's paid at a rate of just 2%, not 13%, on the marginal income of the highest earners. They are going to tackle the issue of over 65s paying it. That's one thing that we have heard, although not the detail of that. All in all, even if you were going to raise any funding from anything that could be called a tax, which national insurance is, isn't this exactly the wrong tax to be raising?
Well, let me take the two points you've raised this. So I do think national insurance is not ideal from the point of view of raising money for all the reasons that you've set out. It does bear more heavily on lower paid people. And clearly one of the real issues is that older people don't pay it. And as you said, the problem is we only know what we read on what's been briefed or leaked to newspapers. I want to listen to what the Prime Minister actually sets out. On your point about breaking a commitment, we did make a commitment about tax and national insurance. We also made a commitment, though, to fix social care, which is why what I've said is I want to see what the plan is to actually deal with social care, because I think if you were able to go to the voters and say, yes, we did raise money, which I understand initially is to deal with the backlogs caused by the pandemic, which no one could have foreseen at the last general election. But we're also going to grasp the nettle and fix social care, which no government has really grasped for a generation. I think you could set that out to people, and I think people would give you a fair hearing. But I think if you were just to raise the money and not fix social care, I think people would take a very different view, which is why, as I said, I want to hear from the Prime Minister what steps the government's going to take to actually fix all of the issues that there are in the social care system. And I think that's what I'll be listening for today.
Is it remotely likely that this plan with an 80-odd majority will be defeated, even if Labour MPs vote against? Are there enough Tory MPs who might vote against this? We're told suddenly there is a bit of backbone, a bit of spine being discovered by some Tory backbenchers who've supinely agreed to everything the government has done on lockdown measures over the last 18 months. But is this? Are there going to be enough to try and defeat this? And perhaps if the measures are not putting actually forward a proper plan for reform. And if there are concerns about this particular tax being raised, is there enough opposition to stop it from happening?
Well, certainly at the moment, I genuinely don't know, Julia, because as you said, all we've read is what we've read in the newspapers. We've not had any actual consultation with Conservative MPs, and I'm going to find out today for real in the House of Commons, hopefully, from the Prime Minister. So I simply don't know. And I think my colleagues will be reserving judgment to listen to what is actually set out. I mean, we all know sometimes you can't always get the accurate picture in these briefings. So I want to see the whole picture, what the tax proposals are, the funding proposals, but I also want to see what it is we get for our money. As you said, Conservative governments are about not what you spend, they're about what you deliver. And I think that's how voters judge governments, particularly Conservative ones.
It is. I mean, I do still find it absolutely extraordinary that a social care plan, which apparently we already had ready in July 19, we're only seeing now, and the Cabinet has not seen hide nor hair of it. Cabinet ministers have been telling political journalists yesterday, haven't seen any detail at all. We don't have Cabinet government anymore, certainly. It's a very worrying development. Let me also talk about where we don't have Cabinet government. And this is obviously the decisions constantly made about how we live our lives under COVID. Apparently learning to live with COVID, but never actually being allowed to do that. That our current freedoms, such as they exist, and an awful lot of freedom right now, go to a nightclub and go to a festival, go to a sports ground, not having to provide proof of your vaccine status, not having limits on numbers, weddings, parties, people in your homes, all very lovely. Three very worrying developments coming up, though, which makes a lot of people worry that it's not going to last for long. One is the bringing in of vaccine passports that, again and again, we were told was not going to happen, but we're told is going to happen at the end of this month. Emergency powers being renewed later this month. Again, there may be some semblance of opposition, but it looks like the government will get that through. And we're told by a member of SAGE that apparently the government is planning, if they feel it's necessary, an October firebreak of restrictions, mask mandates again, and restrictions on numbers of people meeting together in their own homes, and kids missing another week of school. It's like Groundhog Day, isn't it?
Well, yes. Let me take those three things. So on vaccine passports, the government's been talking about this. We're yet to see any proposals. I oppose them, and I will vote against them for two reasons, really. One, because they are discriminatory, and we know there's a difference in vaccination uptake between people from different communities in the country, and they will discriminate against those where vaccine uptake is lower. But also against the Delta variant, which is very transmissible. They don't make a lot of sense. We know the vaccines are incredibly effective at stopping you becoming seriously ill and tragically dying. So they're really good at that. They're not very good at stopping transmission. They're not very good at stopping you. They're not as good at stopping you getting it and giving COVID to somebody else. So vaccine passports simply don't make any sense. They don't do what they say on the tin effectively. So I think they're ineffective and they're discriminatory, as in fact the vaccines minister said earlier this year, and I won't be supporting them. And I hope the Labour Party won't support them either. And we see the Labour Party in Scotland is going to vote against them in the Scottish Parliament. I hope the Labour Party here gets a bit of backbone and Keir Starmer does what he's paid to do, which is to be leader of the opposition, and he votes against them as well. On your point about the firebreak, I don't see any case for that at all. It's absolutely the case, I think, when schools go back, we'll see an increase, or now that schools are back, we'll see an increase in cases. But cases aren't the thing we should be worried about. It's how many people go to hospital and how many people are dying from COVID. And we see that the vaccines are incredibly effective. We're not seeing significant numbers of people going to hospital, and we're not seeing significant numbers of people dying from COVID. You know, COVID's a relatively small contributor to deaths now, much lower than many other causes of death. So I just don't think that's necessary at all. And I hope that's what we'll see when we get to
Well, again, you could argue it would never has been necessary if you look at the stats for the countries and the US states which have not locked down. And again, they see cases going up and cases going down inevitably anyway, as happens with regardless of any government measure. But the key thing here is that okay, say cases go up and we do see increased hospitalisation. Why would we be in a situation, 20 months since we knew about this disease, where we're still worried about overwhelming the NHS? Are you aware of any measures that the government is taking to beef up the actual ability of the NHS to deal with COVID, as opposed to dealing with the backlog of cases as a result of becoming the national COVID service for so long, that will prevent us having to be told we need to limit our lives and have restrictions and damage our economy and our children's education again because the NHS can't cope. Shouldn't the emphasis be on making sure the NHS can cope?
Yeah, well, I agree with you. I mean, first of all, I do think we should make sure the NHS can cope. And I know many NHS trusts have looked at how you deal with COVID and are much better at dealing with COVID patients and also treating them. We've got better treatments now as well as effective vaccinations. But I simply don't see from the data any sense of why this would be necessary. And interesting, Julia, because I know you spent a lot of time looking at all these models. Yeah. To be fair to the chairman of the modelling committee, he's published some fantastic data looking, to be fair to him, how well they've done on the modelling. And if you look at it, it's very interesting. You can see it graphically. Reality has been better than all of the modelling that they've done. Yeah. And none of the pessimistic forecasts have come true. And we just simply haven't seen any of those scare stories that we heard about.
And also, can I say, by the way, none of those have come true, even when we've not had any lockdowns. And people can't say, oh, well, it's because we locked down. No. Even when we had total freedom in August and September, none of them have come true.
No, and the modelling has just not been accurate. And I think, to be fair, the modelling people have always been clear about the fact that it's got its limitations and it's only one factor. I think ministers have put far too much weight on it. And I think that's what they're doing now. And it seems to me vaccinations are incredibly effective. They're doing the job they're supposed to do. And that's why we can get back to normal. As you'll have seen from your television screens, both in August and yesterday in the House of Commons, I think MPs are behaving in a normal fashion, and that's what the country needs to do. And we should have the confidence in the vaccines. It's funny, all these people talking about vaccination don't seem to have any confidence that they actually do what they say on the tin.
I'm sorry to interrupt because time is tight. Talking about the vaccine, the JCVI, the body that advises on immunisation, they've advised so far against immunising 12 to 15-year-olds. On the balance of evidence, there is a marginal benefit, statistically insignificant, they can find, but they are over the known long-term or side effects. They don't know about the unknown ones. There obviously are concerns that there may well be unforeseen circumstances, given that these were not tested on children, these vaccines, and they were not tested long-term on the effects on children's growing bodies. It looks like Sajid Javid, the Health Secretary, for whom I think a lot of us had great hopes, as we have a big sea change from Matt Hancock's leadership on this, that he seems adamant on moving ahead with this, has asked the Chief Medical Officer, Chris Whitty, and others to basically look at this in the round. Should we be going? Should the government be allowing vaccines to be given to children, even against parents' values and permission, when the JCVI says they don't think that the benefits are suitable?
Well, three things. I think it's perfectly reasonable to ask the Chief Medical Officer to look at this. And I think all the evidence from what I've seen from Chris Whitty is he'll do a proper analytical job looking at the evidence.
You've got more faith than I have.
Well, no, I actually think, to be fair, most of the things I've disagreed with over the last year, they have been decisions taken by ministers, not things actually done by the Chief Scientific Advisor or the Chief Medical Officer. So I'm content to wait to read what he says. But you do raise a very good point about the JCVI. One of the things we've got in this country, which I don't want us to throw away, is a vaccination system for children, not just for COVID, but for all childhood diseases, which has an enormous amount of confidence. We have very low anti-vaxxers in this country. We have very low vaccine skepticism. And I don't want us to throw that away. And one of the reasons we have a system which people have confidence in is people know that it's about scientific evidence and scientific advice. And I think that's what parents put a lot of trust in. And I don't want us to throw that away. So whatever decisions are taken, I want us to preserve the confidence people have in the system. And I think that's really important. We don't throw it away.
Mark Harper, Chair of the COVID Recovery Group of Tory MPs, thank you very much indeed.